At Central Florida Foot and Ankle, we really think that we're on the edge of medical technology. You know that medical information doubles every year, and we feel that by going to seminars, lectures, reading publications, magazines, every day we can provide quality of care, but also cutting-edge revolutionary treatments that are available in medical field. One of them is going to be the nerve biopsy that Dr. Kalina talked about, and basically it's a very small procedure that is done in the office under local anesthesia, where we take 3-millimeter punch biopsy from each leg and send it to pathology to be looked under a microscope. We are able to determine what type of neuropathy you have, whether you're a diabetic or non-diabetic, since we know that about 30% of all neuropathies that are documented in the United States are non-diabetic related. Since we would know what type of neuropathy you have, it allows us to better treat you with a certain drug that is specific for this type of neuropathy. Obviously, there are over 100 different neuropathies that are described in the literature today. The other new revolutionary surgery that I perform is toe pass ablation treatment to the plantar fascia. This is also a very new procedure. I have been doing it for about 2.5 years, and I'm very pleased with surgical outcomes. Before that, there was endoscopic plantar fasciotomy that had questionable success rate, and also it majorly altered the biomechanics of the foot, since we had to cut the plantar fascia. With toe pass ablation treatment, we do not have to do it. We use 2 very small endoscopic portals, one on medial, one on lateral side of the foot, and I basically look with the camera and find out where the inflammation in the plantar fascia is. Then I use a low radiofrequency electrode, which is called a toe pass ablator, and I basically remove the inflammation from the plantar fascia. So it completely preserves the anatomical alignment of the foot without cutting the fascia, without cutting any neurovascular bundles. Therefore, I believe that this is the best procedure for plantar fasciitis that does not respond to non-surgical treatment. And the third procedure that is also revolutionary and new at Central Florida Foot and Ankle is tarsal tunnel surgery. Both Dr. Galina and I did a fellowship with a very famous nerve surgeon, Dr. Lee Dillon, at Johns Hopkins Medical School, and we did a fellowship where we perfected nerve surgery, where we believe that at this point we have over 95% success rate with tarsal tunnel surgery. Obviously, we do the surgery under a microscope, where we're able to visualize all the structures of the posterior tibial nerve, including the medial calcaneal, medial and plantar, and medial and lateral plantar nerve branches. So if you have any of those pathologies and you want to find out about new revolutionary treatments for it, please come and see us at Central Florida Foot and Ankle.